Ina is from Cnext. Cnext is one of the beneficiaries of the AI4EU program. They are part of the success stories, and she will present what they do at Cnext.
I'm Ina. At Cnext, so a bit of introduction. Who are we? We are a startup based in Belgium, and we have been delivering services on technical consulting for business process automation since 2007, embarked on our first AI project in 2015, and now we are transitioning towards being a full AI technical product company. So why decision intelligence? It's because Cnext is passionate about innovation, but we also have at our core value to serve people. We believe in a future where machine and AI are not to replace human beings, but they work together to help people do their work better in their everyday life within the framework of trustworthiness, sustainability, ethics. And so with that in mind, we saw a lot of potential for that symbiosis between human and AI in the context of healthcare. And there was an open call in February 2021 for which we applied. And so our journey with the AIs for Support Europe support program started in June and concluded successfully in 3 phases just recently. So what firstly is decision intelligence? It is a discipline that brings together traditional as well as advanced disciplines like big data together to design, automate, and optimize decisions. And we saw a lot of potential for that in the healthcare. So first, a bit of context about decision intelligence. We know that decisions are something which is not done one time. At times, people have to do it multiple times in their everyday life, and it's not a linear process. It can be quite complex with different factors involved in it, and it's not static, it's dynamic. So it needs to iterate and improve over time and also adapt to the changing context. So I will not go into all of the detail, but very briefly over these different steps that needs to iterate to optimize decision. First step, as you can see on the loop on the left, is aware, to first know what is your problem statement, what is the decision for which you require support. And once you know that, you bring in the different points from the business problem, your objectives, into a decision design and a journey. You model that into an AI model, but at the same time, you need to be aware of the limitations of your data, of your model. Is your model fair enough? What is the trustworthiness level? Is it explainable? And keeping that in mind, then you deploy your solution. We all know now about the benefits of Docker containers. You run them, but at the same time, it needs to be auditable. It needs to be traceable. You need to trace the impact of the decisions support that has been provided. And on that, then there is a feedback which can be given by the human expertise as well as the insights that you get from the data. So getting that feedback, you can then improve your model and design to optimize your decisions that aligns the trade-off between all of your objectives and ultimately for your business goals. So with our platform, we use something which we call decision bricks as the building blocks. These are AI models or any reusable components that are used to come together, build up a logic of decision, which we call a decision map. And in order to execute that decision logic, you need a technical framework, which we called as an execution engine. And we support it both on cloud and on premise as well. So firstly, why decision intelligence can be a solution in clinical workflows. We know that with the exponential boom of clinical data over the last years, there is also a lot of a challenge of noisy data. So all of the data might not be relevant for you to be used. At the same time, we know that human beings inherently have this property of cognitive biases. And that is where we see a perfect fit for decision intelligence where human and AI. So a very simple example, for example, if a doctor has to see the patient and recommend them a different treatments or steps and tests for diagnosis, there is a lot of variation over there. You can see on the left side in the diagram, like expected is like the doctor can suggest 5 tests, but at times, on average, it can go from 4 to 7, and it can go as high as 12. This is where the challenge for the doctor or the clinical decision maker lies, that they have to provide the quality care. They don't want to overlook any steps during the treatment, but at the same time, they don't want to advise something which is unnecessary and would bear unnecessary operational costs. So how do we balance this trade-off for different objectives that are to be met while to make those decisions? And that is where we see decision intelligence can combine the insights from data, from AI, as well as human expertise from the doctors to come up with best decisions that would serve the patient as well as serve the objectives of the hospitals or the clinical settings. On the left side, so when we started working on this project, we got a chance to talk directly to the people who are involved in these decisions, to the doctors, to the staff of the hospital. And you can see that from symptoms to the one circled in red is the decision. This is not a one-step process, and there are multiple steps where a doctor has to see what kind of treatment or test needs to be suggested. And here on the bullets, you can see that there are different objectives which are to be met, but to make a decision that meets all of them is challenging, and hence, this is where we can help with AI. So clinical decision support enhances medical decision with clinical knowledge. That is the knowledge from the human experts, patient information, and other health information. So using this context, we worked with on AI4EU support program with CHUL, a hospital in Liège, Belgium. And the case was that helped the doctor to decide if the patient has COVID or not. And if they have COVID, what is the severity of their symptoms? And based on that, make a decision, should they be referred to ICU or should they be sent back to home? So we tested our concepts about that. We combine decision logic. It can for complex decisions, or the idea is that our platform can support as complex decision as it can be, because we can have different components or AI models that can be designed. We can use any kind of machine learning or AI algorithms, any published solution on AI4EU platform, or if you have expertise in clinical AI models, we are also open to hearing interesting ideas and looking for collaborations. And it's not a one-time process. Like once the decision support is provided, the decision maker can also simulate over the results and see what is the impact of different factors which is involved in the decision. And then once you deploy your decisions, you can also retrain them and optimize them over time. So a bit of a small demo about what we did. In the rectangles, you can see these are the decisions. In the ovals, these are the inputs like fever, tiredness, and different age groups. So first, the doctor has to see has COVID or not, as classifying it 1 as COVID, 0 as not COVID. And once that has been decided, if the person has COVID, what is the severity based on if they have fever or not, what is their age group? And the last step is to determine the next step. So these are the decision bricks, the AI models, the inputs. We can make it as complex as we want. We can change the rules over here to see the impact of on the decision. You can add other decision models, knowledge component, decision tables, or bricks to design any complex decision logic. You can run the simulators, so a CT scan of the lung from which from the data we see that it has COVID and it classifies it as 1. Having COVID or not determines severity. It's not severe, but person has COVID, so send them to quarantine instead of sending them to ICU. You can simulate over the different factors and see how it impacts the result. So this has been useful for the clinical decision maker as well. So if you have COVID and it's a severe case, take them to ICU instead of quarantine. So how did Cnext benefit from this program? Financially as well, we had a support of 70K, which was delivered to us in 3 phases. And besides that, also the non-financial support part of it, we published our solution on AI4EU platform. We had a lot of support and regular bi-weekly online mentoring sessions to make sure that we remained on track. and also visibility through AI4 Europe digital channels. The challenge owners, CHUL, they acknowledged potential of platform, and we are still talking to them to see future opportunities. We are looking for new synergies in healthcare. So if you have expertise in clinical AI models or have published solution in AI, we can design them into a decision logic and can run it on our platform. We are also aiming for next year support programs. We got more ideas through this program, and we are aiming for high to test some new concepts next year as well. So we had a successful completion of the programs. The technology readiness levels went up from 4 to 6, and also we are further coordinating with CSUL. If you have any questions, any interesting ideas, you have my email, my phone number. Also in the networking dinner tonight, you're most welcome to share.